3 more people have tested positive for COVID-19 after the Gridiron Club dinner in Washington more than a week ago. Administration officials, reporters, and members of Congress are now among the 72 people to test positive for COVID. New York City Mayor Eric Adams has also tested positive. His office says he woke up yesterday with a raspy voice. He's not showing any other symptoms. He canceled all public events for the remainder of the week. Adams will take antiviral medication and work remotely while isolating. Joining us now, White House Coronavirus Response Coordinator, Dr. Ashish Shah. Very good to see you in this capacity, Doctor. So tell us about this. We got 72 cases. That probably means there are more. What do we know about this COVID variant, and are we seeing as many overall deaths from this latest round wherever we're seeing it?
Yeah, good morning, Mika. Thanks for having me back. What we know about this variant, BA2, is it is incredibly contagious, even more contagious than the original subvariant of Omicron. And it, caused a substantial spike in cases in Europe. It's causing a little bump in cases here in the United States. We're still at extremely low levels. But the good news is that the thing that we care most about, people getting really sick, hospitalizations, deaths, they remain low. We have fewer people in the hospital right now than at any point in the pandemic. That's good news. We're going to obviously want to watch that very closely. But this variant, if you're vaccinated and boosted, you still have a very high degree of protection against this subvariant.
Katty Kay.
So, Dr. Jarrett, it's Katty here. In terms of what the public messaging then should be to people, it's confusing, right? Because I'm hearing all around me anecdotally more people getting COVID, so I've got my mask spat out again. But actually, if people aren't going to hospital, should we now just be treating this as a common cold and not worrying about it?
Well, there are a couple of things. I mean, first of all, there's still a lot of Americans who are not yet vaccinated or boosted. And so when they get it, the consequences are still quite substantial. So we want to continue working on trying to get them vaccinated and protected. That's sort of number one. Number two is I think we should not let this infection run wild. We should absolutely continue to keep it, watch it carefully and keep it under control. At the same time, we don't have to let it dictate our lives anymore. If you're vaccinated, boosted, you're going to be highly protected. We have a lot of therapy now that's widely available for people who are at all higher risk. So even if you have a breakthrough infection, you can get treatments. That means that the virus should not control our lives anymore. And at this point, we should continue focusing on protecting those who are not yet protected.
Doctor, I think by now, most Americans realize that the virus is going to do what the virus wants to do. So how do you control the virus and convince the public that we're almost in the clear in terms of dealing with the virus when you have huge numbers of people in this country who are unvaccinated, who don't believe in the credibility of the vaccine, who refuse to wear a mask because it's become so politicized? How do you deal with that human dilemma?
Yeah, it's a really good question. This has been one of the challenges in this pandemic. One of the things that has, I think, caught a lot of us in public health off guard. I assumed a couple of years ago, if you got these incredible life-saving vaccines, we had public health measures, that people would follow them in the middle of a pandemic. That has been true for many, many Americans, but not, unfortunately, everyone. I think we have to continue sharing the message, get trusted messengers, doctors, other public health people that people trust, religious leaders, to share the truth with the American people and help Americans get protected. That is not something we can at all give up on. We got to continue plugging away at that.
Hey, Dr. Shah, Jonathan Lemire, good to see you again. Hoping you can provide just a little advice for people watching at home as to how they should go about their days right now. We are seeing cases tick up, certainly New York and D.C. quite a bit. Should large indoor gatherings like the Gridiron, how can one of those be safely attended? Should they be attended at all? And also, if someone is sick, anecdotally, it seems like the rapid tests at home are a little slow to pick up this variant, that people might present symptoms for a couple days before registering a positive. If you got the sniffles right now, should you assume you have it, at least until you can get a PCR and clear it?
Yeah, a bunch of good questions there, Jonathan. So let's take each of them. First of all, rapid tests at home do work, but you're absolutely right that there are data that the first day of symptoms, a lot of people turn out negative. So if you've been exposed and now you have symptoms, you should continue testing. And I think in the first day or two, reasonable to assume that you may very well have it. And that means don't go out into crowds. Don't go out and spend time with a whole lot of other people until you've got that negative test. But that rapid antigen test does work. It just takes a day or so to make available. Second is, the treatment, Paxlovid is a treatment that works very, very well. It was in short supply a couple of months ago, less so now. So we need to make that more widely available for people and make it easy for people to get those treatments. We have plenty right now. We're going to need money from Congress to make sure we continue to be able to get enough for the American people. But I think that's making progress. And then in terms of how to behave, I turn to the CDC guidance on this. CDC came out with a new framework a couple of months ago. I was enormously supportive of it well before I came into this current role. It looks at what's happening in hospitals. It looks at infection numbers and makes recommendations. That's what I personally follow, and that's what I would recommend that people follow.
All right, White House Coronavirus Response Coordinator, Dr. Ashish Shah, thank you very much. Great to see you. We appreciate it.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.